How many of you were today years old when you realized that statins, and for the sake of this video, we're going to go with atorvastatin, are used for more than just lipid management? It's true. Lock in. On today's episode of Make It Make Sense Cardiology Edition, I am going to explain to you just why statins, namely atorvastatin, are effective in doing more than just controlling cholesterol. They work for that too. At some point in time, especially if you are a nurse on any sort of cardiovascular unit, or if you're a nurse on a med-surg unit, you are going to have a patient that needs a heart catheterization. Coronary angiogram, heart catheterization, interchangeable terms. You can use those. When they have this heart cath done, they may or may not have blockages enough that warrant intervention. And for the sake of teaching, intervention doesn't always mean a stent. Intervention can simply mean an angioplasty. Another conversation for another time. An intervention can also be going to the OR for full-on bypass surgery. Another conversation another time. I don't want to get ahead of myself. Nonetheless, this patient is going to return to you on some medications that they weren't on previously. One of those medications is likely going to be atorvastatin. Now, you may have this patient have family members present at the bedside, or even some obscure family member by way of telephone that proclaims to work in some facet of healthcare. And everybody's going to want an explanation because, you know, my primary care doctor told me that my cholesterol numbers are fine, so I don't know why I got to take this cholesterol medication. You have an answer for them, nurse, and I'm about to give it to you. This is what you tell them. You tell them that even though your cholesterol numbers may be just fine, the reason why your cardiologist put you on atorvastatin is because of its, here's your new vocabulary word, say it with your chest. You got to say it with conviction. The reason why your cardiologist put you on atorvastatin is because of its pleiotropic properties. Now, at this point in time during the conversation, the room is going to be quiet enough that you can hear a mouse piss on cotton. And that's exactly what you want, because it is at this point in time where you have commanded their attention, because you've thrown a word at them that they don't recognize. And you've also commanded professional authority, because you're about to explain exactly what that word is. Pleiotropic properties. Commit that word to memory. That means that a medication has more value than what its original intended purpose was. For example, you know how Benadryl was created to be an antihistamine, but then later on down the line, people started realizing I get real sleepy when I take Benadryl. So guess what it's used for now? A sleep aid, pleiotropic property. Same thing with Wellbutrin. Wellbutrin was initially intended to be a mood stabilizer. And over the course of time, providers have noticed that it helps with smoking cessation. Pleiotropic property. Same concept applies to atorvastatin. Yes, it is good for lipid management. Without question, that is its intended purpose when it was created. However, it also has additional value because of some of its metabolic properties. Two, to be specific, as it relates to cardiovascular health. The first pleiotropic property is that it has anti-inflammatory properties. How? Good question. Without belaboring the subject, because you can do the research on your own, you're very smart. I'm just going to give you an introduction to it. Atorvastatin has the ability to minimize endothelial transmigration of leukocytes. Big old fancy words that just mean it keeps the white blood cells, which is your inflammatory marker number one. It keeps the white blood cells from moving across the endothelial layer of the artery, especially in the area where any sort of coronary intervention was done. So it has anti-inflammatory properties. What value does that have outside of literally what it says? Anti-inflammatory. Has great value, because when you decrease the inflammation inside the arterial walls, then you enhance or increase the compliance of that vessel. When you decrease inflammation in the arterial wall, the artery becomes less stiff. It becomes more pliable, right? When you have arteries that are less stiff, then you reduce peripheral vascular resistance. What happens when you reduce peripheral vascular resistance? You decrease cardiac workload. The heart doesn't have to work as hard to push blood through stiff vessels. What happens when you decrease cardiac workload? Blood pressure comes down. You ain't see that link coming, did you? Get ready, there's another one. Pleiotropic property of statins, number 2. They increase the availability of the nitric oxide receptors in the arteries. The hell is that? Let me explain. Nitric oxide is a molecule that we all carry in circulation, every last one of us. And nitric oxide's job is to promote vasodilation. You know how when you give patients, especially cardiac patients who are complaining of chest pain, you know how when you give them the nitroglycerin to put under the tongue? What does that do? Sublingual nitroglycerin boosts nitric oxide production. When you boost the nitric oxide production, again, you promote vasodilation. Back to the atorvastatin. The atorvastatin, like I said, it increases the availability of the nitric oxide receptors. Puts more kids in the pool, okay, for nitric oxide. You increase the nitric oxide receptors, then vasodilation is more prominent, more prevalent. What happens with vasodilation? It decreases peripheral vascular resistance. We already went over this. When there is decreased peripheral vascular resistance, there is decreased cardiac workload. When there is decreased cardiac workload, blood pressure begins to remain nice and well controlled. I hope y'all learned something today. I told you I came to change the game for nurses. I came to challenge you. It's not that I want to dispel everything that you learned in nursing school, because the things that you learned in nursing school were valuable, but I just feel like you have gotten incomplete information. I don't want you just to memorize for the sake of test taking. You're smarter than that. You're much smarter than that. You are capable of critical thinking. But in order to be capable of critical thinking appropriately, you got to know the information. Not just what you memorize, but you got to understand it to connect the dots. That's all I'm going to say for today. Because I think I done left y'all in a state of shock. Be good. Have a good one. Bye.